Welcome to Managing MDS. I am Dr. Odenike. Today I'd like to discuss the treatment options for anemia in non-del(5q) low-risk MDS patients who are unresponsive or refractory to ESAs. So as you know, ESAs are the cornerstone of therapy in lower risk MDS, in whom the predominant cytopenia is anemia, and those who have a baseline erythropoietin level of over 500 or who have increased transfusion burden at baseline are less likely to respond to erythropoietin. So this is an area of unmet need in this disease. In addition, individuals who are otherwise eligible to be treated with ESAs, who have had a good trial, which is defined as, at least a 12-week exposure to adequate doses of ESAs, who remain unresponsive. These are individuals in whom we need to try to improve upon in terms of finding other approaches. So approaches that can be considered in this group of patients will include hypomethylating agent therapy, and in particular there is now an approach where an attenuated dose intensity of hypomethylating agents, so either using 3 days of decitabine or 3 days of azacitidine at the standard doses, can be considered in this group of patients. Immunosuppressive therapy can also be considered particularly in lower risk MDS patients who have a hypocellular bone marrow, as there is at least one randomized study that shows that approximately half of those patients may respond to immunosuppressive therapy, which will be a combination of ATG and cyclosporine. With regards to investigational options for those patients, lenalidomide with or without erythropoietin is being investigated. There's a North American intergroup trial that's ongoing, and we're eagerly awaiting the results of that trial. In addition, there's a novel group of agents, the activin receptor fusion proteins, which include luspatercept and sotatercept, that are showing significant promise in early phase trials, and there's now at least one ongoing randomized trial with luspatercept in this patient population that will help hopefully establish a new standard of care for this group of patients. Thank you for viewing this activity.